what is special about these diets and which one should we be reaching for as veterinarians?
Yes. It's always so difficult with skin issues. You have to look, is it environmental or is it food? If you have a peanut allergy, you avoid the peanuts and you're good to go. You're not going to have those symptoms anymore. Same with the dogs. If you have a protein allergy, if you avoid that protein, you're good to go. But we can't take protein out their diets. So what the skin diets do is we break down that protein so that the body just doesn't recognize it as that protein source. The anallergenic is the most hydrolyzed diet on the market. So that's for your very intense allergy cases. With prescription diets, veterinary diets, they're basically the top tier of nutrition. They are specialized for the pet that has a health need, and that can improve that pet's quality of life or even sometimes replace a lot of medications.
A warm welcome back to the Paws Effect Podcast. I'm your host, Dr. Kara, and I'm so glad that you've joined me again. If you're new here, please hit the subscribe button or leave us a rating or review. It helps pet owners find trustworthy vet-led advice in a space full of mixed messages. And a thank you to Stitch. I'm wearing their scrubs today, and like all our team at Hillcrest Veterinary Hospital, I rely on them daily. They look great and genuinely feel amazing to wear, even on the busiest shifts. Today, I'm joined by Dr. Tilana Botha, a veterinarian from Royal Canin. We're discussing prescription diets, what they are, when they matter, and why they're sometimes misunderstood. If you've ever wondered whether prescription food is really necessary, how it works, or how to feed a pet with complex medical conditions, this episode is for you. A very warm welcome to Dr. Tilana Botha from Royal Canin. We're going to be discussing prescription diets today. Welcome.
Thank you for having me.
Oh, so cool. We talk a lot off air. We discuss nutrition frequently.
Yes,
but yeah, we've been saying we're going to have this conversation for the benefit of the listeners for a while. So I am so grateful that we finally got the opportunity.
Finally, yes, yeah. About a year later.
Yeah, you're a busy lady. So thank you for taking the time to come and talk to me, and particularly in person. So very excited to share. So I'm rushing through this because there is so much I want our listeners to get the benefit of your knowledge on all things diet related, but we're going to talk prescription diets today because that's probably an area where we don't often get the opportunity to clarify certain things, and it only becomes an issue if your vet is recommending it, and often it's too late and people just don't understand or know how to make a decision about it. So let's start at the very beginning.
Sure.
What is a prescription diet?
So with prescription diets, veterinary diets, they're basically the top tier of nutrition. They are specialized for the pet that has a health need that is not a healthy pet. It has a specific need that needs to be addressed, that can be addressed through nutrition, and that can improve that pet's quality of life or even sometimes replace a lot of medications or reduce the amount of medications that are needed to manage that health condition of that pet.
So this could be something that could be recommended for long-term or it could be short-term.
Absolutely. So you get some prescription or veterinary diets that are just recommended for short-term use, like a gastrointestinal diet would only be for 3 or 4 weeks, but possibly even 2 weeks, or a calm diet, which would be for transitioning to a new house, or you're a stressed cat or dog that needs it long-term, or you have a skin condition that needs to be managed, or you're a chronic patient that needs that prescription because you have a chronic renal failure, which is chronic kidney failure, that you need that assistance to help your kidneys keep going.
I mean, these diets are like incredible. We obviously, as veterinarians, we rely on them. Like you say, it often either replaces some medication that we would otherwise have to be utilizing, or supports our patients on medication.
Absolutely.
I mean, we're not going to necessarily be able to go into each and every one of them. We might touch on, and I thought, for the interest of the listeners, so they know what to expect, maybe we'll talk a little bit about renal diets and urinary diets, maybe go into some of the intestinal diets, and then touch on the ones for skin, the hypoallergenic and the anallergenic. Yes. But before we go down that path, there are quite a few things that owners query with regards to prescription diets. One of them is, why are they so expensive?
It's a question we get asked a lot. And basically, it's because they're so specialized that they end up being a little bit more costly. They have a lot of research that goes into them. I mean, at Royal Canin, the average is about 4 years to get a concept through to the market so that you've got the food on shelf. So just the research that goes into it, getting it into a kibble that a pet will actually eat. That's going to take an average about 4 years. Even if you look at our anallergenic diet, which is probably one of our most costly diets, that took 10 years to get to market because of the research behind it and getting it to be palatable enough that a pet will actually eat it. Because it doesn't help we have all this fancy food and no one's eating it.
Of course. And I mean, you touched on the word palatable.
Yes.
I mean, there are things that veterinary diets are, in terms of the kind of rigorous things that they go through. So let's talk a little bit about palatability and digestibility, because these are terms that we use very frequently, but may require some clarification.
Sure. Palatability is more around how tasty it is for the pet if they're going to be willing to eat it. So pets don't eat like us. If you take a dog or a cat, they mostly eat with their nose first. They smell. A lot of things go into how palatable a diet will be. It'll be the smell, it'll be the feel, the mouth feel, so how it feels in their mouth, and how it feels in it when it hits the stomach. So not a lot around taste, because they have a lot fewer taste buds than we do. So with Royal Canin, they do quite a lot of research into which factor it needs to be tweaked to get that pet to eat that diet, which is why it ends up being so palatable. And why sometimes, I mean, a lot of pet owners always say they don't want to buy the big bag of food, because then when they get to the bottom, now the pet's getting fussy and won't eat it. The smell's gone. You've lost that smell because that bag's been opened and that aroma is not there. The pet's not going to be tempted to eat it as much as they do.
The other thing people often ask us is, I've made a recommendation of a prescription diet, and I'm going to be fairly vague here.
Yes.
What do we do in terms of now changing over, and we call it transitioning?
Yes.
Talk about the thought process around transitioning and why sometimes it's a immediate switch over and when it's safe to do so, versus it requires time, and why.
Yes. With transition diets, we recommend that you normally do it over a week's period, because we know that microflora needs to adapt. So usually about a week. Fussier pets, we need to do it for longer, 2-3 weeks, however long it takes to get your pet to accept that new diet, because we're not doing it on a whim, we're doing it on the recommendation of a veterinary professional. So what we normally recommend is every 2 days you're increasing slightly the newer food and you're reducing the old food until you get to 100% of the new diet. And that allows that microflora, basically the bacteria in the gut of the animal, to adapt to basically digest that new diet, not to give you the diarrhea and vomiting that can come from switching over to a new diet too quickly, because you don't want to end up back at the vet with a vomiting dog or a dog with diarrhea. And then also what we normally say is that cats, if you put a new bowl of food in front of them, they're not going to munch it. They want to have what they're used to, their favorites, especially the fussier ones. So we want to make sure we don't have food refusal, especially if it's for a health need.
Of course. I mean, there are ways that we try and encourage owners to do that. Can you share some of your top tips as to how to convince your fussy cat to eat the new food?
It's always the fussy cats. Shame. So with the fussy cats, so we normally say in the first 2 days, a quarter of their food allowance that they're supposed to have for that day of the new food, you put that in. And you keep 3/4 of the old food. And then each day, and then for those are the first 2 days. And then the next 2 days, which is day 3 and day 4, you'll then reduce, so it's a 50-50 split between the old diet and the new diet. And then day 5 and day 6, you're going to have mostly the new diet, which is about 3/4 of it, and only a quarter of the old diet. And the last day, you can switch over fully to the new diet. And that's in a non-very fussy pet. But in the fussier ones, you can extend it where you can do it in a 4-day cycle, 6-day cycle, whichever works best for your pet. And if they are hesitant when you've moved over to the next step, switch back down until you get them to accept it, or then chat to your vet, because a lot of these veterinary diets, or most of them, do have money-back guarantee options, because the companies do realize these pets are needing to be on these diets. And if you can't get your pet to eat it, even while you're doing this transitioning diet, the company will actually refund you for that bag of food. And then you can try an alternate diet that the vet will help you decide which one is an alternate that you could try that still fits your health, the health profile of your cat or your dog.
No, that's so true. And I mean, the support that's provided in terms of some of the advice in terms of which diet would be equally appropriate.
Absolutely.
But there is a great range. So we do have some flexibility with most things.
Yes.
So, okay, we've got a really fussy animal. Let's call it a dog this time. We always pick on the cats.
Shame.
And, I love them. How are there some things that we can do in terms of, is warming the food, different bowls? What is the advice in terms of best trying to tempt them if, you're really failing in terms of trying to
Yes, definitely.
Warming,
definitely, because warming will increase the smell. So basically the aroma given off will be increased, and then you're more likely to get them to eat. And shame, we give them a lot of flack for being fussy, but all these little doggies that end up being so fussy, your Yorkies, your Pekingese, all of those that we say are fussy, a lot of the times it's more around the fact that their snouts are so small, they don't have as many scent receptors as the larger dogs do. So then they're not able to smell as well. So if you're increasing the smell, you're increasing the amount of food that they'll be willing to accept. Whereas any normal food that they're refusing, maybe they just can't smell it well enough to actually want to taste it.
I mean, these diets are, like you said right at the start, particularly palatable because there is a desire to get these. So there's a huge amount of time and effort put into
a lot of research
palatability.
A lot of research. You can have the best diet on the market if you're not getting pets to eat it.
Hey there, pet parents. It's Dr. Kara, the Ultra Pet Vet here. Brachycephalic, meaning short-muzzled dogs, have uniquely shaped jaws that can make picking up and chewing normal kibble really difficult. That's why Ultra Pet has created a kibble specifically designed for easy pickup. It contains glucosamine, chondroitin, and green lip mussel extract to help support your dog's joints so that they stay mobile and active. The inclusion of beet pulp and prebiotics helps support a healthy gut by promoting the growth of beneficial bacteria in the digestive system. Omega-3 and 6 fatty acids promote a shiny coat and a healthy skin. Ultra Pet offers 100% money-back guarantee. Try Ultra Pet's premium recipe for short-muzzled dogs today. And how often do you find that you have owners, when you're dealing with those refusal to eat situations, are trying to incorporate medication into these diets? Have you found that a lot?
Which, I mean, a lot of dogs, they are smart. Dogs and cats, they are very smart. They will suss out if you've put some medication in there. So it might be worthwhile to keep that separate, especially when you're doing the initial switch over to the new diet, to keep those two separate. It's not the end of the world if you are feeding something else to just get the medication in while trying to do the transition, to just not associate that food with medication, because then you're going to get food refusal and bad associations. I mean, even with pets that are hospitalized, we tend not to switch them over to a new diet in hospital because they make that association in their minds. And if they've eaten something in hospital while they were ill, they're much less likely to eat it when they go home as a long-term diet. So we try not to switch them even in hospital. So it's definitely, they're smarter than we realize. So
this is part of the reason, just for the benefit of the listeners, why we as veterinarians don't help you with that transition.
Exactly.
Often, when we have a renal patient, we have a renal patient and they're like, but why didn't you stop the diet there? We go, well, actually doing it in the interest of your pet, because we do not want to have a refusal to take that diet when they get home. They're far more likely to refuse it if you try and start it in hospital.
And there are some diets that you don't even need to do a transition diet on. That would be like your gastrointestinal diets. So anything for a diarrhea, an acute diarrhea, so a quick start diarrhea, if I can put it that way, where we have diarrhea and we need to go onto a diet just to help settle the tummy, you can switch over straight away, because those diets are made to be incredibly palatable, because we're trying to get a pet that does not want to eat, that might be nauseous to eat, number one, and they're very soft on the tummy. So they're not going to make them have that tummy feel that I was speaking about earlier. That's addressed quite nicely with the gastrointestinal diets. Even hydrolyzed diets, so diets where the protein molecules are broken down for allergies, skin allergies in particular. Those diets you don't need to do a transition because of the protein that's broken down already. It's a lot less work for the pet's body to have to do to digest those diets. So you can switch them over straight up.
And that's great advice. Yeah, in particular, those ones you have to clarify, because if owners are like, well, I was trying to switch over for a period of time, often it's the original food that just, they need that dietary rest, don't they?
Exactly.
And so that's why you're prescribing those in those sort of circumstances.
Absolutely, yes.
Yeah. So I think let's talk digestibility,
Sure.
because that's one of the other things that veterinary diets are checked for, palatability and then digestibility
Yes.
studies. What is a digestibility study?
So a digestibility study is if you put this protein in this kibble, will the pet actually be able to digest it, absorb it, and utilize that protein? Because the protein content of a diet can look great, it can look beautiful on paper, but if that pet can't digest it and break down that protein molecule and actually absorb it to utilize those proteins, it's kind of useless. It's going to come out the back end. So it's very, very important that not just the type of protein used, but the digestibility of that product is really scrutinized, which is really nice for the veterinary diets. That's a lot of the research goes into that, because we know that what they eat, they need to absorb, and it doesn't need to come out the back end as waste. We want it to actually have a purpose in the body and to do what it needs to do.
I'm going to tackle this really very early on, because I think it's important that we have this conversation. There obviously are situations where home formulated diets are recommended, and we're not here to talk about those because we know the purpose of it. How do you explain to owners, what is your approach in terms of clarifying the difference between processed, which we know that the Royal Canin products are processed, they're kibble formulations, the processed diets that we utilize for veterinary diets, how that differs to processed foods that we associate with as parents, as individuals, as people.
So with the pets formulations, they're not fast food for pets, if I can put it that way. So while a home-cooked diet for a human, it's great. You've got your veggies, you've got your proteins, you've got your starch. With pets, it's not the same concept in that sense, because with our formulated diets, there's so much research done into it that the macronutrients, the micronutrients, every little detail is scrutinized, and not just what is put in, but what can be absorbed is put in, or how much is absorbed, is researched and studied for years before it's added to a diet. And what we're seeing is that with the processed diet, if you can put it like that, a pelleted diet, we can manage exactly what that pet is getting in. We make sure that they're not getting any deficiencies, so that they're not becoming ill without you noticing it from a micro deficiency of something. Because to be honest, even humans, we can't get it right. We can't actually formulate our diets properly.
It's difficult.
It's very difficult to get in all the nutrients you're needing. And with a pet, it's that much worse, because they're a lot smaller than us. Their lifespan is a lot shorter than ours. So any deficiencies or any nutrients that are missing are going to have a much bigger impact on them. So with a pelleted diet, you can be assured that what they're getting in is what their body needs. It's been studied. Whereas if you're doing a home-cooked diet or a home-formulated diet, you're not 100% sure what is going in there, unless you've got a veterinary nutritionist that has formulated a diet for you, but then you need to follow it to the letter. I mean, even if you are told to do chicken breasts versus chicken thighs, the fat content differs greatly between those two. So you're automatically altering that diet and changing what your pet is getting in and what nutrients it's receiving just by switching which part of a chicken you're feeding.
Absolutely.
So it's so difficult.
There's so much variation, like you say, even in terms of water content. But and we see that diet drift as a risk in terms of the home formulators.
Definitely.
You used a great example saying, today I meant to get chicken thighs, but they only had chicken breasts, or vice versa.
Exactly.
And that actually changes the whole formulation
It changes the entire
and the balance.
formulation, definitely. And you can't call up the nutritionist and say, look, I could only get this now. What do I now add or take away to readjust it? Because it's a whole complicated calculation that they'll need to do to go and rebalance that formula for you. And to be honest, a lot of people are not going to be using a veterinary nutritionist because they're not easy to come by in South Africa, unfortunately. But Royal Canin, for example, has boarded veterinary nutritionists on the research and development team that sit in and help with the development of these diets, and then they go and research papers that are the studies that are done on all of these macronutrients, micronutrients, to find out what is the best for your pet. And then they put that into the diet and make sure that your pet can digest and absorb it and use it and live their best life.
Particularly under conditions where they're not well. They're sick. The
exactly.
prescription diets. They, we're talking sort of a normal
healthy pet.
But
Exactly.
we're now saying you've got a pet potentially with underlying disease process that is even more important to get it right.
Exactly. And I mean, if you take a sick pet, we normally say the old go-to is chicken and rice. Which works really great. But if you look at a gastrointestinal diet, I always say it's like chicken and rice on steroids, because it's got so many omegas in there that reduce the inflammation of the gut, which you're not going to get with a chicken and rice diet. And with chicken, with the moisture content of chicken, they're not going to get enough in to actually do what it needs to do. Whereas a gastrointestinal diet, yes, it's got the chicken in there, but it's got so much more.
Absolutely. Totally balanced. So let's use some examples, and then maybe we can talk around some of the other things that I know the listeners will benefit from hearing and maybe want answers to. But let's use the example of the kidney diets, the renal diets, both in terms of how fussy or how difficult it is to transition these pets, but also what is special about these diets.
Yeah. So with the renal diets, like a kidney diet, so we know kidney patients are nauseous pretty much all of the time because their kidneys are not removing that waste from their bodies like they should. So what we do is we make that diet extra palatable, so even more tasty and more aromatic. And that does mean that the fat content is a little bit increased to get them to eat it that much more willingly, because we know that diet is going to replace a lot of treatment that we need to give. So with kidney diets, we want to reduce the amount of protein and phosphorus in the diet, which is really healthy for the kidneys, not so great for a healthy pet, but great for a kidney patient, because we're reducing the work the kidneys need to do in processing of those diets and the waste that the kidneys will produce with the processing of those diets in the body. So if we can reduce the amount of phosphorus in the diet itself, we don't need phosphate binders, medication, unless, of course, you're in more advanced kidney disease where the diet is no longer sufficient on its own. But just by feeding a renal diet, you don't have to give a phosphate binder necessarily. So that's already taking away an extra tablet, and who wants to pill a cat every day?
No, of course.
So you can reduce a lot of the effort that you're putting in just by feeding, because your pet has to eat it anyway. You're feeding them a treatment, if I can put it that way, by feeding a veterinary diet that's prescribed for your pet.
So one of the questions I get, and this is where I was going to with my thought process before, is can we feed all the cats in the household this diet?
That's a question we get asked a lot. So ideally, no. So prescription diets or veterinary diets are very specialized for the individual pet they're prescribed for. So if you take the renal diet, for example, it is low in protein. It's too low in protein for a healthy cat. Your healthy cat will lose muscle mass if it's on a renal diet. So I know it's really difficult to feed multiple cats in one household different diets, but it's really important to try to do that. And if you can't do that, if it's just not possible, then you need to be supplementing them with an extra protein, like an extra sachet of an adult cat diet, but still keep the kidney cat away from that sachet, because it's going to smell good to them. So you've got to keep them away from that and feed those healthy cats that extra protein, because otherwise you're going to end up with a cat that's healthy but losing muscle.
That's great advice. So, I mean, I often know that some cats are social eaters. Yes. Other cats are certainly not. But some cats like to eat when another cat is eating. And so I have had owners say, well, is it okay to feed the same thing, feed them all, they eat together, and then top up the other one?
The other one, yes.
So, I mean, there are strategies.
Exactly. And you, I mean, in the real world, it is so difficult to feed pets separately if they're not used to it. And it's normally the older patients that end up on these diets. And they've got their routines and their way of eating with their housemates. So on those cases where it really is not physically possible, your vet can help you come up with a solution. Just chat to us.
Definitely, great advice there. And we often have, with these renal diets, we have owners saying, one of the things the vets are advising is you need to try and increase their water intake. What do we do here if they're on a prescription diet and we're saying, please increase water?
So the best way to do it is feed them the sachets. Feed them the wet food option of that diet. The moisture content is amazing in those sachets that you get. They're mostly water. So number one, it helps them keep nice and full. It's increasing their water intake. It's getting them to eat the diet. You can heat it up to tempt them if they're not willing to eat it. So it's really a great way to get water in without physically having to syringe feed, which no one wants to be doing to a cat. They don't like it. You don't like it. You don't like the scratches you're going to get. So the best way is to do that soft food, that wet food that comes with a diet that's already in the same formulation, just in a different form.
So important, I think. And we often have, owners going, yeah, but they only eat wet food,
yes.
but these things change.
These things change.
Also in terms of disease process. So I've had cats that would only eat dry and then suddenly offered this very palatable formulation. Exactly. And suddenly you go, actually, I'm a wet food eater.
This one.
Yeah. So it's worth trying and not being set up. The other one I wanted to talk about that I get a lot of questions on are the dogs with skin issues. Mm-hmm. So I know that there are diets within the veterinary range, but also now within the prescription range that are catered specifically for
especially
these.
In KZN.
Yes, KZN is humid and hot.
Yes, and we got a lot of skin issues.
A lot of skin issues, a lot of UV light. So what is special about these diets and which one should we be reaching for as veterinarians first? Because there is cost associated with these, particularly when owners are desperate, you kind of just want to reach for the best one.
The best one. So it's always so difficult with skin issues. You have to look, is it environmental or is it food? If you have, say, hay fever versus if you have a peanut allergy. If you have a peanut allergy, you avoid the peanuts and you're good to go. You're not going to have those symptoms anymore. Same with the dogs. If you have a protein allergy, if you avoid that protein, you're good to go. But we can't take protein out their diets. So what the skin diets do is we break down that protein so that the body just doesn't recognize it as that protein source. So then it doesn't react. So it's like you're eating peanuts, but your body hasn't realized it. You're not going to react. You're fine. You can actually eat peanuts now. And with hay fever, it's something you have to manage. You're never going to get away from your neighbor's tree that's giving the pollen that's making you sneeze. Same with your pet. If they have an environmental allergy, it's something you're going to have to manage long term, and you're going to have to support that skin and make that skin as strong as you possibly can to resist the breakouts that we get, the itchy and the sores and the redness. So what these diets have is they have, a specific diet, for example, is like a hypoallergenic diet. So those proteins are broken down so that the body doesn't recognize it. So where a protein is normally, say, we call it 40 kilodaltons. If you think of beads on a string, normally about 40 beads on that string is about the average size of a protein that will cause an allergy to flare up. What we do with a hypoallergenic is we cut it up, and we cut it to under 10 beads on that string, so that body has no idea what protein they're taking in, but they're getting the benefits of that protein. They're getting those amino acids, which are basically the building blocks of that protein. So they can still use the protein, absorb the protein, live their best life, but they're not reacting to it and having that exposure that's triggering them. So this is what our hypoallergenic diet does. And then we've also got the omegas in there, which help to reduce the inflammation very nicely, and also helps with that nice shiny coat that the owners love to see and the vets love to see on a healthy dog or cat.
Sign of health.
Exactly. I mean, if the body's got time to make this shiny hair coat, they're good. They're good to go. And then what we also have is we have a cocktail in the Royal Canin skin diets across all of the skin diets that helps to actually, if you think of cells of the skin, it's like a brick wall. So dogs with allergies, especially environmental allergies, have a genetic component to it where the cement between the brick wall actually has cracks in it. So it's allowing environmental allergens to actually get in there, and it's losing water through there. So water loss from the internal to the external. So if we have that complex in our skin diets, it actually almost tightens up those little gaps. So it reduces the amount of allergens that can get into that skin and the amount of water loss. And we know if you have dry skin, you're itchy. So if we can reduce the water loss on the skin and we can reduce the amount of allergens that are actually getting through that skin barrier, we can reduce that itchiness of that pet a heck of a lot, which then reduces the need for medications or as many medications or as higher doses as what we normally would prescribe. So you can get away with either no medications in pets that have food allergies, or you can get away with a lot less frequent vet visits and a lot less medication if you have a dog that has environmental allergies, if you're feeding the right diet.
These diets are life-changing. I know.
It's amazing the science behind them.
So tell us about the analergenic and how that differs to the hypoallergenic.
So the analergenic is the most hydrolyzed diet on the market. So where hypoallergenic is under 10 beats on a string, the analergenic is under 1. So it is tiny, tiny, tiny. So that's for your very intense allergy cases. And it's usually used as a diagnostic tool, so almost like a test. So if you have a broken bone, you take an x-ray. If you have a food allergy, you do a food trial. So that's 8 weeks where you're feeding just a specific food like the analergenic, and you see if that pet then after 8 weeks doesn't itch. If it's not itching, it's a protein allergy. And then you know you've made your diagnosis, and then you can either continue on the analergenic or you can then go onto the hypoallergenic. If your pet doesn't have a severe allergy, then you can definitely transition to the hypoallergenic. And most pets can transition to the hypoallergenic, but you will get the occasional one that needs to stay on that hypoallergenic. And the really nice thing about these hydrolyzed diets is that they can be used even for gastrointestinal issues like IBD. So if we're taking away that protein source that's causing the gut upset, and we are already breaking it down for the animal, it's almost like a pre-digested meal, if I can put it that way, where the pet has to do a lot less work and you're getting a lot less of your IBD symptoms.
And we spoke about that in my recent case where we were dealing with IBD and EPI. So that's great that these diets have multiple purposes.
Multiple purposes.
I think the important thing for me to ask here before I lose my thought process is why then do we say exclusively? And I think owners often, and I want to know how best to communicate this, because owners often don't get what we mean by saying that means nothing else. So explain why.
So maybe I should touch on so if you're going to feed anything else, you're changing the composition of the diet. It's almost like the chicken thigh versus chicken breast scenario. You're changing what your animal is getting in, because if it's eating something else, it's eating less of that diet. So it's getting a lower amount of the nutrients it needs to manage its condition. Plus now it's getting other nutrients that might be worsening that condition at the same time. So you're going to cause a ruckus. I could even maybe use our urinary as an example, where our urinary diet is to dissolve stones. So it's called a dissolution diet. It dissolves struvite stones in the bladder. So if the bladder has now stones in it and you feed the urinary diet, those stones will dissolve. But if you're feeding something else on top of it, that diet now no longer is as effective or hasn't been studied with whatever you've now added into the diet. So we have no guarantee that those stones are going to dissolve at all.
So it could change the pH.
It could change the pH, because we know pH is a big factor in the development of these stones. Or then it even changes the solutes, so the minerals that are present within the body and the bladder. So then you are likely to form stones, because now you're adding to the mineral content and not feeding the mineral content that's been studied, that's in the pelleted form.
And in the same way, we're going back to our intestinal diets. We're saying we want bland food, highly digestible, things that are not going to upset the gut.
Exactly.
And then suddenly you're adding in something that might just throw everything off. So this is why we say exclusively.
And there's normally a reason, like with a food trial. If you're feeding something while you're doing a food trial, you won't know what your results are at the end of that 8-week period. It's very tempting, and we know it's very difficult to say no to those puppy dog eyes, but it's for their benefit. It's not because we want to be mean or put them on a strict diet. It's just because we want to make sure they're healthy and to be able to get to that diagnosis if it's a food trial, or to make sure that we don't overwork their kidneys or overwork their liver if it's needing to be on a renal or hepatic diet.
Yeah. So what are some of the strategies for people who say, but they expect a treat? How do you manage that?
So the nice thing is with the Royal Canin, it's very palatable. So a lot of the times you can even use some of that kibble as a treat. So we always say feed the pet, not the bowl. So once you've weighed out the daily allowance, take a few of those kibble and put it in a snack jar if you need to. And
always feels better if it's coming from the snack jar.
Exactly. It feels better when it's coming from a snack jar. And your pet will love the taste already. It's their food. But they're getting that extra attention from you because it's now a snack from their snack jar. So you can definitely do that. And if you need to, we've got the wet options available for a lot of our diets. And you can use that also as an added treat.
That's really, it's great because I think a lot of the psychology around this is our need.
It's our need.
But we get that.
And your pet would probably do just as well with you throwing a ball for them or just scratching them or playing with them a little bit. But we feel the need, we want to treat them. So definitely have that snack jar or a specific container that you put a little bit of their daily ration in, and then you feed them that as a treat throughout the day when you're rushing out the door and you want to just give them a little bit something just to remember you by.
Our pets are very good at conditioning us, aren't they? They're like, but
I'm
where's
not
my
sure
snack?
who trains who.
Exactly. I was actually watching the most fascinating thing about, we're talking scent, about search and rescue dogs, and this guy threw a key into the river and this dog, and I'll end the story there because he rewarded that dog. I was waiting because, we all want to find out what happens. I was waiting to find out what happened when the dog got into the river and found the key, lay down, and he rewards it with a toy. And I think, we as pet owners often think the reward is with food.
Exactly.
So we can change that.
We can change it.
I must practice that. So one of the things that I get a lot is my dog was always itchy, suffered from all these allergies until I went on a raw diet. Can we talk raw diets?
Sure, we can, yeah. So raw diets,
controversial.
It's very controversial. It's becoming a lot more popular. It's basically, for me, my main issue, or one of my main issues with it would be that I don't know what formulation I would be feeding, in the sense that I don't know what micro and macronutrients I'm getting into my pet. Yes, dogs are descended from wolves, if you want to go down that route.
A long time ago,
number one, we've bred them to where they are today, so they don't even resemble wolves. I mean, I don't think anyone can make them look much like a wolf, as a Yorkie. So it's just, I don't know if it's going to help. And a wolf's lifespan was also a lot shorter than what we've got today with the diets that we have today. So that's also quite telling if you're seeing that the lifespan is increased so dramatically. And what I also always say is, if you're going to be feeding a raw diet, at least cook the food. So there's been a lot of studies done on raw diets versus just cooked raw diets, if I can put it that way. And the bioavailability or the digestibility of those is very similar. So there's not much difference in cooking it appropriately versus feeding it raw. So you could almost say a raw diet versus a home-cooked diet. And if you're going to go that route, then at least cook the proteins so that you don't end up at the vet with salmonella. I mean, even at the Congress, they were speaking about salmonella shedding in pets, and how some pets are now being refused entry into some vet hospitals because of the potential for them for shedding salmonella if they are a raw-fed diet pet. And we don't want to get to a point where we have similar situation in South Africa where your pet now poses a risk to other pets within a hospital that are already there because they're ill or compromised. And we don't even know that our pet is maybe potentially shedding salmonella, but we've been feeding the salmonella-infested chicken, the loveliness. So if you're going to be going down that route, by all means, cook it. But do we be aware that that diet is not managed by a nutritionist, so you're not 100% sure you're getting in all the needs of your pet. And if you're going to do it, then I would say stick to the healthy pets. The pets that are now ill or have a chronic disease, let's take a look at how we can help you feed them best for their condition, even if that means, yes, home-cooked, but with a veterinary nutritionist.
Absolutely. And I mean, I think that you made a point there that, they shed it and you're not even aware. They're not clinically sick.
Exactly.
But that they pose a risk not only to if they come into hospital, but also at home. We know that our bond and our contact with our pets is definitely changing. And, we see our kids playing with them and they're grooming their coats. I can just, with a chemistry degree behind me, I imagine bacteria everywhere.
Exactly.
So I have a very visual mind, and that's and I think, it's fine if they are bacteria that do not pose a risk to you from an illness perspective. If you're immunocompromised, young, old, not well, it's a very high risk for
very, very high
little reward when there are other solutions.
Thing. I mean, the digestibility component, because raw diets have become so popular, they have been looking at the digestibility and how how well are these diets absorbed? And yes, there are some reasons to believe that some raw diets can be better absorbed than a pelleted diet. But that's why the pelleted diet is studied so thoroughly to make sure that we get that digestibility score so high. I mean, if you look at Royal Canin, it's not more than 90% digestible. So we know the digestibility of that diet is really, really good. So if you're going to take that as a comparison, it's not much of a comparison if you're going just for the digestibility factor. If you're going for the descended from wolves factor, it's also not much. I mean, that argument's already been made. So if you're wanting to cook something for your pet, by all means, if you have the time and energy, which I know I do not, by all means, go for it, but do it properly. Get on board, get a hold of your vet. They can put you in touch with a veterinary nutritionist that can then help you with a proper diet and then stick to it.
No, I do worry, and obviously there, particularly for some disease states where people who really have a desire to, and the time, the capacity, and the financial means, because I often find that
it's a lot more expensive.
It's expensive. It's really expensive, and I say that's fine, but I would rather go with a formulated diet that has undergone some research.
Absolutely.
You put it in the hands of Royal Canin, for example. They have tested, and I don't mean like people imagining lab rats, but they have gone through all the studies in order to ensure that these diets are safe and balanced.
And I mean, we've got our own campus where they do these testing, and it's non-invasive tests. So, for example, they have cats that are trained to make a wee in a certain special container so that they can measure what the pH of that urine is. So they don't have to go and get that urine sample. The cats are trained to give it to them. So it's non-invasive testing. It's fecal scoring. So looking at the poop, seeing at what score is this poop. If we've now eaten this volume, we're now passing out this volume, and it's looking like this. So it's non-invasive testing and I mean, those dogs and cats live their best lives on that campus. They constantly have cameras on them, I'm sure, but they are living their best lives, and they're having non-invasive testing, and they are making sure that what we know of our diets is 100% sound. And
I think people need to be aware that if you're going to feed your dog a home formulated, even prescription based diet, your pet is that test subject.
Absolutely.
And I would probably encourage you to do some digestibility studies on.
Have a look-see.
Because you want to make sure that what you're feeding, as you said right at the start, is actually being broken down correctly.
And used.
Absorbed and utilized by the body.
Because you'll see it. You'll see the more you have to pick up in the yard, more poop you have to pick up in the yard, the less is actually being digested.
Of course.
So you want to be, if you're feeding a Royal Canin or a veterinary diet or even one of the maintenance diets, you'll see that you're picking up a lot less in the yard than you would be if you were feeding a diet that's not usually recommended at a veterinary practice.
Let's talk about the myth that veterinarians are not equipped or trained to offer dietary advice. Because we see quite a lot of you.
Yes.
Let's talk about that, because I think it's important maybe just to give some insight into our level of knowledge.
Sure. So, I mean, maybe I should start at the top. So I get trained by our SciComm division, which is basically our scientific communications managers. And they get trained by our global team, who have the research and development team on their side. So we're getting trained right from the people that make the diets. And then we come around here, and then we teach the vets that are using the products what the product is, how it's utilized, why it was made in the first place, and how it's going to benefit that pet. So vets get quite a lot of training from the different brands that are within the vet practice to know which product to use and when, because if we use it in the wrong patient, it can also not be the greatest thing. It can sometimes cause adverse effects. If we are feeding a non-renal patient, like we said earlier, a renal diet, we're going to cause more damage than we're going to help. So vets definitely get quite a bit of training, and they offer up a lot of valuable time that they could be consulting to actually have these trainings. And every CPD event, so vets have to do continuous professional development, where we have to get a certain number of hours in training from specialists. And at these CPD events, usually there is a nutritional talk associated with a lot of them, where vets are then taught on the product en masse. So vets are quite knowledgeable about nutrition and about the products that they have on their shelves.
And I mean, we're taught to think critically. I mean, a lot of these lectures are supported by research journal articles.
Absolutely.
There's discussion around this. It's not just you're presented with something and it's full acceptance. That,
exactly. Exactly. And I mean, if you can think of it like this, the R&D team trains our cycle managers, who then train us, and then we train the vets. So literally the information that the R&D development team have on hand is what we're providing the vets and what they have on hand to be able to educate the clients and to recommend the best diet for their pet.
Talk about the kind of support that Royal Canin offer if owners are having an issue, whether it's transitioning or struggling with some of the consequences of, or whatever it may be. What kind of support do they offer?
Anyone is welcome to contact our customer care division. They are amazing, and they are very quick with their response times. So they will help you, and they will put you into contact with a BDO, which is basically the rep within the area that can assist you. They can get you a bagged trial. They can get you, depending on the situation, they can get you money back if you have an adverse event with any of your products. They can give you advice on the products or put you in contact with a vet like myself who is on the Royal Canin team that can take you through the entire product and why it's beneficial to your pet, that can run you through the transition period. We can do all of that for you. You just have to pick up the phone or type up that email or Facebook Messenger, and we will get a hold of you. That's no issue at all. We're quite happy to help because you need to be informed what you're putting in your pet's mouth, and we want the best life for pets. And if that means we need to take a little bit of time just to go through it with you, we're more than happy to do that.
I know you guys are very good, very supportive. Yes. My final parting question. Yes. Why is it that owners can't buy these prescription diets off the shelf at the supermarket?
So a lot of that has to do with it's so specialized. So it's not just for a healthy pet. It is for pet with a specific need that the vet knows the details of. So the vet's done the blood work, the vet's done the x-rays, the vet's done the surgery. The vet knows that patient and knows what needs need to be met for that patient, so they know which diet to recommend. Whereas if someone doesn't have access to that data, they can't actually recommend appropriately, and they might be recommending something that could be detrimental, where you're recommending a diet that's maybe too high in protein for a kidney patient, or you are recommending, say now you do have a veterinary diet on shelf and it's recommended by a not veterinary practice. Some of them can cause deficiencies or muscle loss. So we don't want these products being recommended by anyone except the person who knows that pet's health history and the specific dietary requirements for that health history and for whatever diagnosed disease condition that pet has.
Yeah, that's so true. And I mean, I think, that goes back to why you have to understand that a prescription diet is specifically prescribed, recommended to your pet, not necessarily to the household.
Exactly.
But there are lots of things that we question and ask and try and inform, and that is part of the consultation and support that practices are able to offer. Absolutely. In terms of how to go about tempting. There are lots of strategies.
There are loads of strategies, and we've heard some fun ones.
We've heard some very fun ones.
So reach out to us if you have magic tips and tricks.
Yes. We'd love to hear how you get your pet to take something that we struggle, something like a tablet, whether you convinced your pet to take it in the food, because we certainly fail, unless they're Labradors.
Labradors will eat everything and anything.
They're not fussy, but I'll take a tablet.
Yes.
Thank you so much for your time today, Dr. Tilana.
I really appreciate it.
It's been great. I know that we could go into more depth, and if there is an appetite for it, perhaps we can target some of the other prescription diets and actually just focus around how they actually meet the needs of those particular chronic conditions. Yes. But at least we've touched on
a little bit of everything.
And hopefully the listeners have really benefited from it. So thank you again for your time.
Thank you so much.
Thank you so much for tuning into today's episode on the Paws Effect Podcast. If you found the discussion helpful, please like, share, and follow our podcast. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform. Welcome back to Just for Pets. You're with Dr. Cara.
Hi, Doc. It's Jackson the Jack Rossi here, and boy am I itchy.
Are you on a hypoallergenic diet?
Hyper what now?
Changing to a special diet will really help. And Just for Pets have a massive range. And flea and tick medication, special shampoo.
Ooh, how quick can you get some?
Order today and we'll deliver pronto.
I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.